Here to activate, we're talking now medulla, lowest part of that brainstem, okay? Big parasympathetics, okay? We have inside of this medulla, we have the inferior olive, which is where like the cerebrum and the cerebellum are sending a lot of their pathways through. It's connecting those two parts up. And it's also that last part before we get into that the spinal cord, okay? So all that information that comes out of the brain that needs to make a connection down to the body has to pass through the medulla, okay, and get down into the rest of the spinal cord, okay? The medulla has a lot of nuclei in it that are in charge of respiration, blood pressure, swallowing, and things like that. The nerves that are located in this area, okay, we have cranial nerve number 9, okay, the glossopharyngeal, okay? A lot of that is sensory to the throat on the inside, okay? It also has taste to the back third of the tongue, more of like a bitter taste sensory in there, and then it also does a little bit of motor control in the throat, just specific muscles to swallow. Okay, another nerve is cranial nerve number 10, the vagus. Okay, big rest and digest parasympathetic. It's the nerve that travels from that brainstem down into innervating the gut and the digestive system on that one as well. We have cranial nerve number 11, which does motor of the sternocleidomastoid, that big muscle in the front of the neck, what comes from the back of the head to the front. Okay, it allows us to turn our heads left and right, and it also does the trapezius muscles. And then the last one, cranial nerve number 12, right off the bottom, is the hypoglossal nerve, and that does mostly, well, it just does motor to the tongue. Okay, that is the brainstem. That is the medulla. We see a lot with leaky gut patients. We see a lot with digestive issues. A lot of those types of things are regulated through that digestive system, through that vagus nerve. Vagus nerve is the biggest one that I mainly focus on and look at as we're looking through that lower part of the medulla. But come on in, we'll get it checked out, we'll come up with a care plan, and we'll get you rocking and rolling.